Hi, my name is Anna and I'm part of Group 4. Along with my fellow team members, we are here to discuss with you how CDSS, better known as Clinical Decision Support Services, can be beneficial to a physician when providing care for their patients that suffer from diabetes. We're going to look at how that system can affect their care, as well as the benefits to using a CDSS and the effect of it improving their A1C levels, LDL levels, and hypertension. We've prepared a presentation for you to go over some of the points that we would like to share. I hope you enjoy our presentation, and I'll see you at the end of the presentation. In the United States, there were roughly 30 million diagnosed and undiagnosed individuals with diabetes. Also surprising, in 2002, nearly a quarter of all senior citizens in the U.S. had diabetes, both diagnosed and undiagnosed. With all these individuals with diabetes, it came at a staggering cost of $245 billion, with $176 billion in direct medical costs. Unfortunately, diabetes is one of the chronic diseases that requires a lifelong commitment and daily management. Although diabetes requires a lifelong commitment and daily management, there are major issues concerning the care and management of diabetes, patients' adherence to lifestyle changes and drug therapies, and failure of the provider to accurately provide the right drug therapy. Diabetes care in the United States has been improving over the last decade or so, but it is overall plagued by unsatisfactory care management. With the number of diabetic patients constantly rising, there is a need for a more aggressive management of this chronic disease, as well as a need for a stronger system to predict and limit the effect that diabetes has. There are many other medical conditions that diabetes can cause, such as hypertension, eye blindness, strokes, heart attacks, kidney diseases, and amputations. Being able to manage and limit the effect that diabetes has on an individual will also have a drastic effect on the cost that this chronic disease has on society. But first, the importance of using an HIT system, such as a CDSS program implemented into an EHR system, will need to be realized. A CDSS system that can help healthcare professionals treat, diagnose, and plan the care management of diabetes patients will dramatically help in the improving of diabetic care. While with some other chronic diseases, non-adherence to lifestyle changes and drug therapy adherence may not play a big role, with diabetes, it plays a major role in managing the lifelong chronic disease. Many individuals do not achieve good glycemic control and continue to suffer health problems as a result. Up to 1/3 of diabetic patients may fail to derive optimal benefit from therapy because of medication non-adherence. Non-adherence to medication comes at a cost in the effect of more hospital services utilization. It is estimated that each 10% increase in medication adherence results in a mean decrease of 6.6% in all-cause hospitalizations. While some may adhere to the recommended medication adherence, those that do not often require their physician to make medication changes to supplement this. A CDSS system could help health care professionals decide when it is right to make changes to medication to supplement medication non-adherence. CDSS programs can be the changing force behind limiting the effect that non-adherence has on the cost diabetes has on society as a whole. A diabetic CDSS is designed to provide more detailed information than the regular CDSS. You may be wondering, how? Well, it's something called clinical algorithms. The clinical algorithms integrate patient data based off of factors such as age, sex, current medications, renal functions, history of coronary artery disease, congestive heart failure, and A1C, LDL, and blood pressure levels. With the help of Microsoft Access Application Database, the server stores definitions, queries, tables, and code snippets. The Personalized CDSS is centered off current treatment, comorbidities, and distance from clinical goals that advise on drug and dose, suggested clinical visit intervals, and corrective actions. It is formatted in a highly visual display that can be understood at a glance and used to plan future appointments. Below is an example of the technology that is involved in the CDSS system. As you will see, there are examples of 3 types of questions at the bottom. Was glucose treatment modified? Was blood pressure treatment modified? Was Lipman treatment modified? These are very important questions within the CDSS to allow the physician to make the best decision possible. For CDSS to be effective in the complete management of diabetes and its complications, clinical providers must assess CDSS early in the clinical encounter. According to healthit.gov, for CDSS to be effective, clinicians must be inspired and committed to using these systems to achieve desired results. To improve clinician buy-in and support, healthit.gov suggests the use of CDS implementation clinical champions, also known as physician champions. These PCs promote CDS intervention and are the liaison between end users of the CDSS and technical staff to enhance clinician buy-in and use. When looking at CDS integration into clinical workflow, it is very important that there is proper integration of a diabetes CDSS into the clinical workflow. This will enhance use by physicians and improve patient care outcomes with regards to proper management of diabetes. This is very important because according to healthit.gov, CDS systems which disrupt or obstruct clinical workflow are not easily adopted for use. Thus, easy access to templates, useful advice regarding management, drug-to-drug interactions, and alerts and proposed plan of care will enhance patient care. According to a study conducted by NIH, the threat to professional autonomy dissuades physicians from readily adopting CDS systems. The balance between relying on professional experience or on CDS templates poses some concerns for physicians. In addition, due to its relative newness, clinicians are concerned about legal implications surrounding the use or non-use and/or overriding of CDS systems in patient management. Below is the CDSS implementation model. The first step in this model is to involve the stakeholders and communicate the goals. Next, assess readiness for implementation. Then we move to select effective clinical leaders and champions, followed by assemble the CDS implementation team. Then achieve clinician buy-in and support, following by integrating the CDS into the workflow, training and supporting the team, planning for a successful rollout, monitoring and evaluating the CDS's clinical impact, and finally, knowledge management. Here are a few users that would be involved in the implementation of a CDSS model when working with diabetic patients. Physicians. Physicians are the ones that are in charge of the direct care of the patients. Also involved in the care of the patients are nurses or other clinical staff that may have encounters with the patients while they're being treated for their diabetes. Next, we have diabetic case managers, and even pharmacists get involved to ensure that the medication levels that are provided to that patient are correct. Physicians are very affected by all of this, as they are the ones who are diagnosing, treating, and planning for future care. They can come at times with mixed views and preferences. It is vital to include those that will be affected by the change or implementation to have a part, as it could influence their end views in the entire process. While being involved in the implementation process can have an effect on the satisfaction, the effectiveness of it can be even more influential. As Paul Levon once said, more important than the actual changes implementers might make are their skills at communicating them to users and linking them into users' experiences. Implementation activities that assist users in making sense of and coping with changes, contrasts, and surprises should contribute to system success. Now we'll look at a case study from 2011 in which CDSS for diabetes was implemented using an intervention group that had diabetes and had significantly better hemoglobin A1C, better maintenance of blood pressure control, borderline better maintenance of systolic blood pressure control, but not improved low-density lipoprotein cholesterol levels than patients of physicians randomized to the control arm of the study. Also among the intervention group physicians, 94% were satisfied or very satisfied with the intervention, and moderate use of the support system persisted for more than 1 year after feedback, and incentives to encourage its use were discontinued. This case shows a perfect example that results can change views of those that use the system. The National Diabetes Education Program maintains an online resource to help healthcare professionals design and implement more effective healthcare delivery systems for those with diabetes. Studies have shown that by involving patients in the plan of their care, we find that they have improved outcomes with lower A1C and LDL levels and decreased blood pressure. The NDEP shares 3 objectives. The first one being optimize provider and team behavior by prioritizing, goal setting with patients, ensuring that there are no barriers to care. The next one being support patient behavior change by encouraging diabetes care through a systematic approach. And third, changing the care system is a priority for providing high quality of care. Here we have Monica. Monica is a 45-year-old African-American female who has presented to her primary care provider with complaints of new onset blurred vision, fatigue, increased thirst, and a wound on her arm that is slow to heal. She presents with vital signs of a blood pressure of 157/90, a weight of 200 pounds, and a height of 5'2". After her physician reviews her symptoms, Monica's doctor decides to draw a panel of lab work. The following week, Monica returns to see her results and is horrified to find that her hemoglobin A1C was 8.0, while her LDL was also high, and therefore her physician diagnosed her with early onset adult type 2 diabetes. During that visit, Monica is educated on diabetes management and discusses a care plan with her provider. The provider explains to her that he would like to take the approach of a patient-centered approach, to include her into the process through a program built into her electronic healthcare record. Monica leaves the office that day with a prescription for an oral medication for her diabetes, supplies, and specific details on checking her blood sugar and her plan to increase her activity along with diet modifications. Over the following 3 months, Monica ensures that she checks her blood sugar first thing in the morning and then 2 hours after her meal. She then records those numbers into a log that is assessed through the patient portal of her EHR. Through that EHR, she is able to communicate with her healthcare team and is able to ask questions, update the team on how she was doing, and progress with her new plan of care. After 3 months, Monica returns for a follow-up and recheck of her lab work. Monica informs the nurse obtaining her vital signs that she's been pleased with the plan and that her ability to communicate with the healthcare team provided her with a lot of support. Monica is so happy to see that her blood pressure has now lowered to 130/80 and her weight to 180. Her follow-up lab work also shows a lot of improvement, with her A1C down to 6.5 and her LDL down to 150. Monica's primary care physician is pleased with her results and how well her blood sugars have been controlled. Monica is instructed to continue with the same plan for the next 3 months and then return to the office for another check. Below we see the EHR-based CDS Diabetes Wizard implementation model. In the middle, we see measurably improved outcomes from the EHR Decision Support Tool. And on the outside of the box, we see communication and process measurement, standardized care team process, maintain up-to-date evidence-based recommendations, and programming with seamless EHR integration. All of these factors are necessary in providing a successful CDSS diabetes implementation into an EHR. Hey there, welcome back. We hope you enjoyed our presentation on CDSS and all of the ways that it can help to benefit patients who suffer from diabetes. We understand that there's a lot of options out there that physicians have, but as we've shown you through our presentation, we find that CDSS is one of possibly many options that a physician can utilize to better provide higher quality care to their patients. We hope what you take away from this is that CDSS is beneficial, can be helpful, and is one way of many to help our patients. Thank you for watching.